Okay, can everybody hear me? Can everybody hear me? If you can hear me, clap. Thank you all so much for joining us tonight. My name is Deborah Goldman, and this is
Grant Golden.
We are co-chairs of this event, and we want to welcome everybody for coming tonight. We know that some of you are going to Babel, which is a wonderful event, and so we'll do our best to keep to our schedule so that you can both eat and hear the entire program. I want to introduce Michelle Casey, who is the president and CEO of Planned Parenthood of Central and Western New York. If you can all give her a round of applause. And one more round of applause for all of you for coming tonight.
Thank you, Deborah. Thank you, Grant. And thank you, everybody, for coming this evening. We really appreciate your support. I'd like to recognize a few people who are in the audience this evening. And can you please stand for a round of applause. Karen Nelson, who is the past CEO here at Planned Parenthood of Central and Western New York, who is currently the president and CEO of Planned Parenthood of Maryland. Karen! We have Erie County Family Court Judge Lisa Block-Rodwin. All right. New York State Senator Tim Kennedy. Good friend of Planned Parenthood. And Lieutenant Governor Kathy Hochul. Woohoo! And Lieutenant Governor, will you please come up and say a few words?
Thank you, Michelle, and she definitely put an emphasis on the word few, so I'll be very brief. I am absolutely thrilled to be here, and I look at this room, and I have to tell you, the support I received from Planned Parenthood, from Michelle, from people like Holly Levy, and all of you, I can't tell you what it did for me just a few weeks ago. I know this is not a political event, but I think you know what I'm talking about. So I want to thank you, people of Buffalo, the women of Buffalo, Planned Parenthood of Buffalo, West New York, etc., for all you've done for me. And because you've been such supporters of not just myself, but of all the women in this country who look to you for your leadership, to be their voice, to protect their rights, their values, and indeed their bodies, I want to say thank you. And you can count on Governor Cuomo and myself to continue leading the resistance against all the really evil people. If you heard that quote from Donald Trump yesterday, the really evil people who are trying to strip away our rights. I am a fighter, everybody in this room is a fighter, and I cannot think of a more powerful group of individuals than the people in this room and my friends from the TAP Fund who will be singing tomorrow night to stand together to protect the rights of women all across the state of New York. Thank you very much. I love all of you. Thank you.
I'm so proud to have the Lieutenant Governor from our part of the state. We couldn't ask for a better champion. Another round of applause, please. I'd like to take a moment to thank the major sponsors of Strength in Numbers. And please, if you could hold your applause to the end. Herbert Siegel and Aaron Siegel, Clover Management, Benderson Development and Delta Sonic, and Hodgkin Russ. Now Deborah Goldman will say a few words. She is not only the co-chair of Strength in Numbers, but also the chair of the board of directors of Planned Parenthood of Central and Western New York. Deborah?
Thanks, everybody. We have a great deal of news at Planned Parenthood despite the current political climate. The first, which you may have seen in the news, is that Planned Parenthood of America has a new CEO, Dr. Leanna Wen. She will lead Planned Parenthood into the future. She's fabulous. The second piece of good news is that we've completed the renovation of our health center in West Seneca. It's now much larger, can accommodate surgical abortions, and is more welcoming to our patients, including patients from a much wider area, easy to get to and on public transportation, which is great. Now I'd like to take a minute to talk about Promise for Tomorrow. Grant and I are happy to be Promise for Tomorrow members. Promise for Tomorrow is a society of our most dedicated supporters. Promise for Tomorrow members make significant 5-year commitments to Planned Parenthood of Central and Western New York. The investment is in the sustainability of Planned Parenthood through this tough political environment, and it ensures high-quality health care will be accessible throughout the community for years to come. Can you hear me? It's okay. Okay, good. Planned Parenthood Promise for Society members are invited to 2 or 3 special events each year to get the inside scoop on Planned Parenthood of Central and Western New York activities. If you are not already a member and would like to learn more about Promise for Tomorrow, please see the information at the back of the room. And also, Ren Hauser, where's Ren? Ren will be happy to talk to any of you about Promise for Tomorrow, as will Carolyn Parr. Now I'd like to introduce Carolyn Hoyt-Stevens, daughter of William B. Hoyt, for whom the Hoyt Award is named.
I think it's fabulous that we're in a new location this year, and shout out to everyone at Rich's who does such a fabulous job for this organization and so many others in Western New York. So good evening. I'm really happy to be here to present this award, named in honor of my father, who was a fierce advocate for choice and reproductive freedom throughout his career. Cameron Rockwell Green became involved with Planned Parenthood because a friend invited her to an event very much like this one. Cammie and her husband Chris heard moving presentations and decided immediately to become Promise for Tomorrow Society members. That was almost 12 years ago. Since then, Cammie has become an active, passionate volunteer and advocate for Planned Parenthood. Cammie attributes Janet Wisbaum, a friend and mentor, as playing a huge role in getting involved. And I'd say there's probably a lot of people here tonight thanks to Janet's encouragement, including me. So Cammie discovered that her mother-in-law, Jane Green, had been an active Planned Parenthood volunteer. And Chris remembers as a young boy driving around in his mother's station wagon filled with signs, brochures, and Planned Parenthood materials with a prominent Planned Parenthood sticker on the windshield. The well-known, beloved, late Dr. Robert Patterson, an OB-GYN, who so many people remember, I think he was my mother's doctor, was a devoted Planned Parenthood supporter who was Cammie's doctor, and her sister Petra Patterson's father-in-law, and a family friend who in his later years was a resource and wise counsel to Cammie, willing to share his views and hopes for global reproductive health. Cammie discovered later on that in high school, her daughter Mandy had been advising friends to contact Planned Parenthood to obtain confidential, accurate, factual information concerning women's health. And I know there are probably a lot of high school girls out there who know who Paula Parks is. Planned Parenthood has been a multi-generational affair in the Green and Rockwell families. Cammie grew up in Buffalo, is a SEM grad, and she majored in economics at the University of Denver. She came back to Western New York and is married to Chris Green, whose advocacy for Planned Parenthood is also really noteworthy. Thank you, Chris. She has 3 children and 6 grandchildren, some of whom are here tonight. Cammie has always been, quote, involved, and often actively involved behind the scenes with so many organizations. At Planned Parenthood, Cammie has been a member of the Community Engagement Committee since its inception. She and Chris chaired 2 Planned Parenthood celebration events, helping to raise critical funds for the agency and to introduce Planned Parenthood to potential supporters. She has marched in support of Planned Parenthood, hosted parties in her home, including a tour of the big mobile unit that was parked out front, and so much more. As a nonprofit fundraiser myself, I know how valuable advocates and ambassadors like Cammie can be to moving an organization forward. Cammie salutes Planned Parenthood for being there no matter what and is unapologetically pro-choice. She cares deeply about providing equal access to reproductive and basic health care for all, regardless of financial ability, especially for underserved communities. On behalf of the Hoyt family and Planned Parenthood of Central and Western New York, I am very proud to present the William B. Hoyt Advocacy for Choice Award to Cameron R. Green. You get to say so. Oh my God, look at all the cameras. Let's over here.
Next, I have the pleasure of introducing Karima El-Bahari, who is treasurer of the Planned Parenthood of Central and Western New York Board of Directors. Karima will be giving the award to Liz Clark.
Thank you, Dad. I'm really excited to be giving this award. I've known Liz now about 15 years. She was my board chair when I first stepped on the board of Planned Parenthood. So I'm going to read from my notes because she is an extraordinary woman. Elizabeth Clark comes from a long line of extraordinary women. Her grandmother, Catherine McGillicuddy Lavers, was one of the first women to attend Northwestern University School of Dentistry in Chicago. She graduated in 1901. She even opened her own dental office in New York City in order to support herself and her children after her husband left her. One of those children, Liz's mother, Catherine Lavers Clark, not only graduated from Barnard College in the early 1920s, but went on to graduate school at Columbia University, where she received a master's degree in chemistry. During those years, she played cello in a dance band at the famous Roseland Dance Hall to pay her expenses, something that shocked the faculty at Barnard. Go figure. After graduating from Columbia, she became a researcher in syphilis at the Rockefeller Institute for Medical Research, followed by a job as a chemist at DuPont. After marriage, she worked in jobs in social work, which did not require a degree, and ultimately returned to college at Rutgers, received her second master's degree in social work in 1962, when she was 61 years old. Liz followed in their footsteps. Born in Chicago, she spent her childhood in the Northeast and Midwest as her parents moved frequently for employment. She attended Syracuse University and visited the local Planned Parenthood while she was in college, an organization she had been aware of since her mother had been on the board of the Planned Parenthood in Toledo, Ohio. At first, Liz studied nursing before switching to elementary education. This was the 1950s, a time when there were few options still open for women. After teaching for a few years, she married and had 3 children. When her own marriage fell apart, Liz began selling real estate and supported herself and her children as a single mother. Seeking greater financial security, she took the LSAT at the age of 45 and applied to UB Law School. After graduation, she commenced her second career at Hutchinson Russ, where she spent 22 years, eventually becoming a partner. Liz loved practicing law and felt rewarded by it in many ways. Liz has been active in many community groups, including the Women's Committee of the Buffalo Museum of Science, HOME, which stands for Housing Opportunities Made Equal, the board of the Buffalo Philharmonic Orchestra and the Buffalo Philharmonic Foundation, the board of the Universalist Unitarian Church, where she has sang tenor in the choir for 52 years. And, with a friend, started the Orchard Park Recycling Program in the early 1970s, and too many other committees to mention. Liz became involved with Planned Parenthood in the 1980s, initially as a donor, and she began serving on the board of directors in the 1990s, and was the chair of the board when Planned Parenthood of Erie County merged with Planned Parenthood of Niagara County. For those who want to know, that was 2006. She has recently served on the Finance Committee as one of my committee people, and is a Legacy Society member. Ultimately, she believes that her work with Planned Parenthood has been the most meaningful part of her volunteer work. Liz specifically cites the feeling of being part of something that makes a real difference in people's lives. As other Planned Parenthood's volunteers say, we save people's lives sometimes. Congratulations to Elizabeth E. Clark for her Planned Parenthood of Central and Western New York Lifetime Achievement Award. Thank you.
Thank you all so incredibly much. Planned Parenthood is the love of my life, and I'm so glad to see you all here and in support. And the only thing else I have to say is, on November 6th, vote.
Congratulations, Cammie and Liz. One more round of applause. Thanks. Now I have the pleasure of introducing Dr. Jamila Perritt. Dr. Perritt is a fellowship-trained, board-certified obstetrician and gynecologist with a comprehensive background in family planning and reproductive health. An important leader in efforts to promote greater equity in healthcare, particularly reproductive healthcare, Dr. Perritt has extensive first-hand knowledge of the subject. She provides on-the-ground, community-based care focusing primarily on the intersection of sexual health, reproductive rights, and social justice. Dr. Perritt is a 2010 to 2011 Physicians for Reproductive Health Leadership Training Academy Fellow and a passionate advocate for reproductive health and rights. She works as a clinical provider and reproductive health consultant collaborating with local and national organizations to provide subject matter expertise on sexual and reproductive health, family planning, and reproductive justice. Let's give a Buffalo welcome to Dr. Perritt.
We talked a little bit about the pronunciation. For those without easy names, the pronunciation is always a challenge for the person who's doing the introduction. But thank you so much, Deborah. I'm trying to see if does this stick in here? I don't want to hold it if I don't have to. I got it.
Okay, great.
Thank you. And thank you all so much for welcoming me here tonight. I'm excited to be back in Buffalo. Surprisingly, I've been here before. I've been to Buffalo now 3 times in the last 2 years, so it's nice to be back. You know, we're here tonight. Oh, do I need to click or do you click? Can I click? No? Okay, you click. So our charge tonight, as you can see from the slide that's on the screen, is to talk about reproductive justice. Oh, not yet. Don't click. I'm going to take the clicker. I'm going to try. Okay. But this is going to be tricky because we only have 20 minutes and I think I just spent 5. But I'm up for the challenge, so I hope that you'll join me. As you can hear in the introduction, I'm a board-certified obstetrician and gynecologist with subspecialty training in family planning. And as a family planning specialist, most of my time is spent hyper-focused on reproductive health. And a lot of that time is also spent in the abortion space. And so that's usually what I'm asked to talk about, that part of my work. And usually the questions are about the technical and procedural parts of my work, right? How is an abortion done? What medications or instruments are used? How do we prevent and manage complications? But not tonight. Tonight we're going to talk about something a little bit different. Maybe a little bit more abstract, but I think equally as important. And so, before we get started, I'm going to tell you a story. No, I've been demoted again. I don't think so. Yep. Again. And now I hear you say, she only had 20 minutes, she spent 10 so far. And I'll admit in the effort of full disclosure, I've never been able to tell a short story. But you're going to have to bear with me because the story I'm going to tell you tonight is a story about how I got here, standing in front of you this evening. This is my story. I don't know that anybody growing up says that they want to be an abortion provider. And I certainly didn't. Maybe some people do, but it wasn't me. But I always wanted to be a doctor. And I can remember I was one of those really obnoxious kids, that used to walk around with the fake doctor's bag and the plastic stethoscope. And I, would diagnose friends and family, anybody really who sat still long enough or came close enough with all kinds of imaginary diseases and illnesses. I would do fake surgeries and pretend blood draws, and it even dispensed medication in the form of Tic Tacs. And I was and still am the undisputed champion in the game of operation in our house. And I don't know where this came from. I didn't grow up in a family of physicians. I didn't really know any doctors growing up, but somehow I knew that this is what I was supposed to be. And I can remember when I was applying to medical school, people would ask, well, what are you going to do if you don't get in? What's your plan B? And I'll be honest with you, I never had a plan B. I didn't consider not getting in because I knew this is what I was supposed to be. Now, I grew up in Washington, D.C., the seat of the federal government, the home of the President of these United States. Somebody said boo. Washington, D.C. is my touchstone. It's my point of reference. It's my home. People come from far and wide to visit my city, and they often leave having learned a lot about the history of this country and about the city that I come from. But one thing that most people don't learn when they visit Washington, D.C., something that they don't hear on those hop-on and hop-off bus tours, is that Washington, D.C. is also home to one of the greatest income disparities of any city in the United States. It's a place where the top 10% of earners make 6 times more than the bottom 10%. Huge pockets of poverty. In my hometown, the maternal mortality rate is twice the national average, and the HIV rate is 3 times the CDC's definition of an epidemic. Growing up in Washington, D.C., and bearing witness to these inequities, it shaped me as an individual and as a physician I would become. Now, although I grew up in Washington, D.C., my family's roots are planted firmly in the South, where the legacy of segregation continues to cast its shadow far and wide. Stories of what it was like to grow up in the Jim Crow South live in my family's recent memory, and they're told and retold by those who experienced them. The legacy of Black bodies that were bought and sold, consumed and destroyed of, loomed large in my childhood. And those who survived were living testimonies of how and what the world thought of us. These were not stories or fables talked about during Black History Month in school, but lessons that were passed down to ensure the survival of the next generation. The knowledge of this legacy, it shaped me and it shaped my family, and it influenced the way that I was taught to view the world and my place in it. It demanded an understanding of us that the playing field is not level. There are opportunities I wouldn't have privileges I would not be afforded, not because of what I can do or who I am, but because of what I look like. Everyone doesn't get the same shot, and no, it's not fair. And as I continued my journey out of Washington, D.C., to Philadelphia for residency and Baltimore for fellowship, and back to my hometown where I live and practice now, I carried these lessons with me. And so here I am tonight standing before you, the doctor I always knew I would be. Now, I do realize I wasn't asked to come here tonight to talk to you about myself. I was asked to talk about my work and reproductive justice. But I start with my story because my story is directly related to my work. I bring every part of myself to the work that I do. My story, my history, my legacy, it follows me. It follows me into exam rooms and into encounters with my patients. It hangs and it hovers. It colors, and some days it consumes. It impacts the way I walk and I talk and I move through the world. It does this for me, and it does this for my patients. Their history, their legacy, their story. It impacts the way that they interact with me in that moment and the way that they interact with the healthcare system in general. It influences their willingness to follow recommended medical advice and the likelihood that they'll disclose risk-taking or unsafe behaviors. It shapes the way that they perceive the patient and provider relationship and the way that they understand my place in it. When we talk about what it means to be a healthcare provider providing care within a reproductive justice framework, it means understanding that abortion and contraception and pregnancy happens like everything else within the context of people's lives. And so when we as physicians and public health agents, as activists and advocates seek solutions, these solutions must be grounded in that context as well. And that's where the reproductive justice framework comes in. But in order to understand this framework and how and why it came about, I want to go back a bit. And this history is important because it helps us understand that contexts are not randomly distributed, but instead are influenced by history and the current cultural structures that reinforce historical injustices. They help us understand the roots of stratified reproduction in this country. The United States has a long history of regulating what those with the reproductive potential can and cannot do with their bodies. We saw it evidenced brutally and explicitly in the way that slave masters controlled the timing, agency, frequency, and autonomy of reproduction for enslaved African women. We saw it in the eugenics movements in the United States that was sanctioned, promoted, and supported by the United States government and resulted in well over 60,000 documented involuntary sterilizations. A practice that was so common that in Mississippi it was called the Mississippi appendectomy, a term made popular by civil rights activist Fannie Lou Hamer to describe the common practice of sterilizing poor Black women in hospitals in the South. Oftentimes, tubal ligations and hysterectomies were done on poor Black women as practice for medical residents. And this is not a notion that was unique to the South or even to Black women. And we see that Native women experienced the brunt of this as well. And from 1970 to 1976, more than a quarter of all Native women were sterilized in a program that was a joint partnership between the federal government and the Indian Health Services. Coercive contraceptive practices continued, and the most common reversible contraceptive method we use today, the birth control pill, was brought to market only following testing on poor women on the island of Puerto Rico, many of whom only knew that they were taking a medication to prevent pregnancy and not that this was an experimental drug. We saw these pernicious stereotypes of the hyperfertility of Black women continue well into the 70s and 80s and 90s. And this is not evidenced in any greater way than the use of Depo-Provera in Norplant in communities of color. Depo-Provera is our predecessor for the LARC method, the contraceptive implant that we use now. And initially it was heralded as a breakthrough for reproductive freedom. But quickly we saw the marketing shift towards poor women, young women, and women of color. Its use was linked to public benefits and reduction in jail sentencing in the carceral system. We saw it discussed as a means of social control and not reproductive freedom. And so when we look forward at recent incidences, sterilization, abuse, and contraceptive coercion continue. And sometimes it looks like criminalization of pregnancy outcomes, like that of Purvi Patel, who was suspected of inducing a miscarriage. It also looks like coercion and manipulation of women with substance use disorder, like the organization Project Prevention, who pays women with substance use disorder to have sterilization procedures and long-acting reversible contraceptive places. It looks like continued incidences that are being discovered of mass sterilization, like those detected in California prisons in 2010. Most of the women who were poor women and women of color. And it also looks like continued linkage to penal codes and reduction in jail sentencing for individuals who are willing to get sterilized or to have these device places. And we saw a growing enthusiasm, as we saw growing enthusiasm for long-acting reversible contraceptives in this country, we saw these coercive contraceptive counseling practices continue. And so when we think about and examine disparities in unintended pregnancy and abortion rates and contraceptive use, it becomes clear that these communities that are most likely to experience these disparities are also communities who have been historically and traditionally marginalized, targeted, and abused. Individual and community experiences with contraception and abortion and pregnancy interact within a complex web that's overlaid in the social, historical, and societal context in which we live and operate. We can't address one without acknowledging and addressing the other. And reproductive justice does just that. There's no one specific definition for reproductive justice, but organizations like Sister Song and Forward Together all operate under their own. But they share a commonality in that they're designed to address the limited attention paid to diverse communities in the reproductive rights movement. At its core, reproductive justice is focused on changing structural dynamics and power. It concerns itself with a broader vision of the reproductive rights, reproductive health movement that includes marginalized populations at its core. I want to take just a few minutes to review these definitions because sometimes I hear them used interchangeably or conflated. Reproductive rights, reproductive health, and reproductive justice, although related, are not the same thing. Reproductive rights, reproductive health is what we do in our health centers. It's the provision of care, and it typically focuses on the normal male and female reproductive system. Reproductive rights focuses on protecting access to legalities that provide reproductive choice, and is historically focused on protecting the right to access abortion and contraception. Now, reproductive justice, on the other hand, places reproductive rights within the social justice framework. And you can see in this chart here some of the primary strategies, actors, and organizations that operate within these spaces. And you can see at the top that reproductive justice is designed as an organizing and movement building framework. It was never designed to be placed in the healthcare delivery system. So just because you're providing healthcare does not mean you're providing it under a reproductive justice frame. But it also doesn't mean that you can't. When the women met who coined the term reproductive justice and this concept that integrated reproductive rights and social justice met, it was a group of 12 women at the Illinois Pro-Choice Conference in Chicago. And they began to discuss their lived experiences and the context and the framework of the reproductive rights movement in the United States at that time. And they acknowledged that as Black women, they were often left out of conversations about reproductive rights and left out of access to healthcare more broadly. Not wanting to use the language of choice, given that they represented communities that had no real choices. Instead, they integrated the term reproductive rights, social justice, and human rights to coin a new phrase, reproductive justice. A few years later, in 1997, 16 women of color-led organizations came together to form the Sister Song Reproductive Justice Collective, with an effort and a focus towards grassroots mobilization and public policy change. In order to effect this change, they wanted to do several things. One, they wanted to draw attention to the importance of changing these structural inequalities that impact the ability for individuals to exercise their reproductive rights. They also wanted to focus on the social, political, and economic inequalities that impacted this decision-making, and they wanted to acknowledge the intersectionality in women's lives and the impact that had on reproductive health. The reproductive justice framework rests on three tenets. One, this human right to be able to decide when and if you have a child and the conditions under which you give birth. The human right to decide if you will not have a child and to have the information you need to end or prevent a pregnancy. And the human right to raise the children you already have with the necessary social supports and environments that are safe and communities that are free from violence from the individual or the government. I want to go back to this piece about intersectionality briefly because we should not be in any room, in any space where we're discussing reproductive rights and not hear this term intersectionality. Coined by legal scholar and critical race theorist Kimberly Crenshaw in 1989, it rests on the understanding that our identities are not separate, just as our oppressions are not. And these multiple layers of our identities create unique experiences in our lives, but more importantly, unique oppressive existences for individuals. And it's the synthesis of these oppressions that creates the conditions of our lives. In including intersectionality in this framework, the pioneers of reproductive justice acknowledge that the oppressions that people of color and poor people and LGBTQ folks and immigrants face is often not just additive, but it's multiplicative. They converge and coalesce to create a perfect storm of inequity and injustice. It looks like poor access to quality health care. It plays out in bans on insurance funding for abortion, like the Hyde Amendment. And it manifests in targeted LARC promotion in some communities and not in others. For our communities, our healthcare systems as they exist now serve to highlight and perpetuate the existing inequality in our lives. They perpetuate stigma. They perpetuate fear. They perpetuate isolation. They reinforce the dominant narrative that women of color can't be trusted to make decisions about our own bodies and our own lives. The systems that align to result in women of color having higher rates of unintended pregnancy and abortion are the same ones that ensure poor access to health care, that eliminate social supports, and that maintain the pay gap along gender and racial lines. This framework reminds us that the reproductive options that people face is structured around the resources they have or do not have. Having or not having access to support, including family and community social support, shapes the meaning of choice. Now, this doesn't mean that choice is not important, but the pioneers of the reproductive justice framework wanted to reject the language that focused on the primacy of choice in the movement, because after all, what good is the right to choose if you can't make it to the clinic to exercise that right? If you can't walk safely in your community and drink clean water and eat healthy food and send your children to schools that aren't failing them? When systemic inequity is our platform, focusing exclusively on choice is fundamentally disrespectful. The reproductive justice framework calls for us to ground our work in history, the history of our country, and the history of the community we serve. It calls attention over and over again to the ways in which those without institutionalized power continue to be victimized and marginalized by our health systems. Embracing the reproductive justice framework allows us to connect to broader progressive movements, to affect social change, and to change the discourse around reproductive health and reproductive rights in this country. The fight for reproductive rights must always be lifted up beside the fight for economic justice and racial justice and immigration. These fights are linked in the lives of our patients, and so must they be in our work. Intersectional oppression need not be intentionally reproduced to be harmful. Intention is irrelevant. Just because you didn't mean to do harm doesn't mean you didn't cause harm. At the heart of our work must be a commitment to reproductive justice. But as Loretta Ross and Ricky Solinger wrote in their book, Reproductive Justice: An Introduction, the problem is not defining reproductive justice. The problem is achieving it. Thank you.
Thank you so much, Dr. Perritt, for your inspiring and fabulous presentation. You really gave us all both food for thought and food for action. So, again, thanks. Thank you to all the members. Can you hear me? Good. Okay. Thank you all to members of the Board of Directors and former board members of the Board of Directors. Thank you to the Community Engagement Committee for your hard work on organizing Strength in Numbers and making it such a success. Thank you to the Professional Committee for your behind-the-scenes work. Thanks to our volunteers this evening, and thank you to our staff. I know that they're professionals, but they don't do this work just for a job. They do this work because their hearts are truly in it. Thank you all so much for coming and for your support of Planned Parenthood of Central and Western New York. We couldn't do it without you. You're all wonderful. Can we give you all a round of applause? Now, the food stations, I hope, are open. Are they? They're open? Okay, now just like you're on an airplane and the people with a tight connection get off first, can we make, we've all been there, I think. For those people, can we let the people who are going to Babel get something to eat? You don't have to show your Babel ticket, we trust you all. And the rest of us will have a little more opportunity to talk and then eat and talk. Again, thanks.